So I'm going to dive right into our presentation. All right, so today we really just wanted to start by sharing that this is really just an introduction to your work with HPSM. We will be providing at least one other training, and we will continue to be available to you all to answer questions. We know that this is a new benefit or program that we're offering, and so there's a lot of information that we'll share today. Just to assure you, we will continue to be available to answer questions throughout the year. So today we're just going to share a little bit about HPSM, the steps that you would follow to see one of our members, how HPSM communicates with our providers, and then at the end we will have time for questions. So as some of you may already know, excuse me, Health Plan of San Mateo is a managed care health plan that provides healthcare benefits to San Mateo County's underserved residents. We are what is known as a county organized health system per state designation. And so almost all Medi-Cal enrolled residents in San Mateo County are our members. And HPSM manages programs that provide healthcare to more than 147,000 San Mateo County residents, which is about 1 out of every 5 San Mateo County resident. And we have a diverse member population. There are more than 20 languages spoken in San Mateo County. The most common among our members are English, Spanish, Mandarin, Cantonese, Tagalog, and Arabic. HPSM has 4 coverage programs. The first is Medi-Cal, and the majority of our members are Medi-Cal members. Eligibility for Medi-Cal is determined by the state of California based on income and other factors. And Medi-Cal eligible members must live in San Mateo County to be eligible for HPSM Medi-Cal coverage. We also have Care Advantage, which is our program for members who are eligible for both Medicare and Medi-Cal. Many Care Advantage members are elderly and or disabled and have a low income. HealthWorks is the only commercial product that HPSM currently offers. It is a program that largely covers in-home support services workers and some other county employees. Our ACE, Access and Care for Everyone program, is a locally funded care program for low-income adults who do not qualify for Medi-Cal. And HPSM serves as a third-party administrator for ACE. San Mateo County is the service area, and most services for ACE members are provided by San Mateo County health providers. This is a general breakdown of our membership. The largest percentage of our members are Medi-Cal members, about 78%. About 15% are ACE members, and smaller percentages are Care Advantage and HealthWorks members. And community supports benefits are available to eligible Medi-Cal as well as Care Advantage members. And what are community supports? Community supports are optional services that are offered to eligible Medi-Cal and Care Advantage members and are not a benefit but are medically appropriate and cost-effective alternative services with the goal to improve the health outcomes and quality of life experienced by high-income members by addressing social determinants of health. Okay. Okay. Sorry, next slide. Okay, so now we wanted to go over the steps that a provider would follow to see an HPSM member. And the first step would be to receive or confirm an authorization for an HPSM member. And to speak more about our authorization process, I'm going to pass the mic over to my colleague, Gail. So Gail, let me make sure that you can unmute yourself.
Hi, can everyone hear me?
Yes.
Okay, perfect. Thanks, Molly. Um, so I think we all know that community supports are optional services, but we are required to treat it as if it were a benefit, therefore requiring a prior authorization. So next slide, please. So what is a prior authorization? It is a process through which HPSM verifies that a service is a medical necessity before our provider is authorized to provide the service. Our community support services that you provide to our members will require a prior authorization before providing the service or starting the services. For ECM and community support services, it may be that another provider may submit a prior authorization request. You may receive an authorization notification letter for a member that you didn't request a service for, so it's important to note that. Next slide, please. So HPSM, like ECM, it's also launching community supports with a specific group of members. These are the members that are existing members already serviced through MSSP, whole person care, and the community care settings program CCSP, and they are automatically folded and authorized starting January 1st. So I see this group as the grandfathered in members that will continue to receive ECM and community support services with their current providers and have a 6-month authorization starting January 1st. So there were ECM and community supports, or CS, transition notification letters that were sent to the members that were impacted, and this notifies them of this change and that there were no changes to the care management or community support staff. Their provider, or all of you as applicable, should likely already have talked to them about this change or will be talking to them about this change. Newly eligible members, these are the members that HPSM will identify to meet community supports criteria, will be loaded into HPSM's authorization system with authorization start date to be determined. So we'll be giving updates regarding this process in the next month. HPSM will work on setting up a process for authorization for all other members, and those updates will also come during the month of February. Next slide, please. Members that are receiving community supports that transition to whole person care, MSSP, or transition from whole person care, MSSP or CCSP, as mentioned earlier, will be automatically authorized or have been. For continuation of these services, a prior auth request form must be submitted prior to the authorization end date. We will be updating our CalAIM landing page on our HPSM website for more guidance on this process. More information will be coming specifically around how to request authorization. That'll be coming in February, and a second training will follow with more details. and that'll include workflows. Molly, I think I can hand it back to you.
Yes, thank you, Gail. Okay, so once you verify you have an authorization for a member, the next step would be to check that member's eligibility. And checking member eligibility verifies that the patient or member is actively covered by HPSM at the time of your service. And it's important to verify this because if the individual is not covered on the date of service, HPSM cannot reimburse the provider. Eligibility usually changes monthly, but can also change more frequently. And so best practice is to check prior to every visit or service that you render. And how to check eligibility. The easiest way, we believe, to check member eligibility is on HPSM's provider portal. You can sign up for our provider portal on our website using the link here, and that will allow you to verify member eligibility by logging on. If in any case you cannot use our provider portal, you can also verify by phone at the phone numbers that are listed here. And on the topic of our online tools, HPSM has two portals for you to use. One is our provider portal that allows you to check, as I mentioned, eligibility and also to submit claims online. We also have our e-reports portal, which is where you can view your remittance advice statements, also known as RAs, which will show you the detail of your claims payments. You can register for both of these on our website. And if you need any assistance, you can always contact our claims department. Here's a quick view of the login screen to our eReports portal and a direct link to sign up for eReports here as well. Okay, so once you've verified that the member you would like to see is actively covered by HPSM, the next step is, of course, to provide the service to the member. And then after you render the service, you will want to submit a claim to HPSM. There are a couple of different ways to submit claims to us. Many providers work with clearinghouses to submit claims electronically. HPSM works with Office Ally and Caperio, which are two clearinghouses. And so we can receive claims that way. You may also submit claims directly on our provider portal, as was mentioned, using our online CMS 1500 form. We do recommend electronic claim submission through one of these two methods for the quickest turnaround and claims payment. But if for any reason you can't use these methods, you can also submit claims on paper and just mail them to our main address using the CMS 1500 or UB form. And then for certain providers, you may also need to submit a monthly encounter report. More information on that will be shared individually. For submitting claims, we recommend submitting the claims as soon as you can after you complete the service. You have up to 6 months to submit the claims for full reimbursement. After 6 months from the date of service, the reimbursement amount will be reduced as shown here in this table. And we wanted to share some tips on submitting claims. We do not accept handwritten claims, so if you do need to submit a claim on paper, it must still be typewritten. We accept either CMS 1500 forms or the UB04 form. As mentioned, we do recommend submitting claims electronically whenever you can. It will help speed up the process. And we can also sign you up for electronic fund transfer or direct deposit. Make sure you receive your claims payments directly to your bank account. And in terms of completing the claim form, you may see claims issues if the form is incomplete or contains errors. So we do recommend using this resource we have on our website, which demonstrates how to complete the form and which categories are required by HPSM. If you have questions about how to do that, we are also happy to review that with you and answer any questions. And then for the monthly encounter report that some providers may be submitting, the same thing applies in terms of any incomplete or incorrect fields may require correction and resubmission of the report. Okay, and in terms of claims coding, when you receive an authorization, it will cover all relevant codes. We did want to share this resource on coding information, and more specific information on coding may also be shared with you all individually in the course of your contracting process and or in our upcoming additional training. We wanted to share some common billing errors that we see that may cause issues with claims payment. One is ensuring when you see an HPSM member that you use their correct member ID to submit a claim. The member's ID number can be found on their member ID card if they have their card from HPSM. If they do not have their card or know their number, you can also locate that on our provider portal. Making sure you're using appropriate coding, including diagnosis codes, making sure that you have a prior authorization for the member if it's needed, and then ensuring that you have the correct providers and PIs listed on the claims form. Okay. So after you submit your claim, you will confirm your receipt of payment. If you are signed up for our eReports portal, you'll be able to view the details of your claims payment there. So if there are any issues with your payment, you can see why those may have occurred. And if you do find that there are issues with your claims, there are a couple different processes to follow. And again, this is a lot of information to share, but we do recommend saving this presentation. We will share it out and referencing this should you have any claims questions in the future. So after you submit a claim, hopefully the claim pays correctly. There are no issues whatsoever. If for any reason the claim does not pay correctly, if the claim completely denied, you'd want to go ahead and submit a new claim. If the claim denied and you realize that that was due to an error on the claim or some information that was left off, you'll want to go ahead and submit a new corrected claim through the same process that you submitted the original one. If the claim partially paid, but there was an error or something left off that caused it not to fully pay correctly, we have a claims corrections process that will allow you to make changes to that claim form to, potentially receive the additional reimbursement without having to resubmit a whole new claim from the beginning. Our claims correction form is available on our website. It can be completed and sent in to us by mail using as well as a corrected version of the CMS 1500 form or UB04 form. And so again, this process can be used to fix a claim that was partially paid as well as if you ever realize that a service was billed in error and you need to notify HPSM that the service was not in fact rendered or was rendered differently. Okay. And then if for any reason you feel that your claims were denied in error in a way that wasn't due to a mistake on the form, you may dispute that. You may dispute the decision on the claim. You can submit an individual provider dispute resolution form, which is available again on our website. If there's a large group of claims that you'd like to dispute, you can submit a specific form that allows you to list out those claims and fax it to us at HPSM, and they will be reviewed. Okay, so that's a quick overview of what to do if you notice any errors or issues with your claims. And then just to continue on to kind of some general points, we did want to highlight regarding billing that balance billing is prohibited by law. So for our Medi-Cal and Care Advantage members, providers cannot balance bill the member for any cost sharing that's not related specifically to the member's share of cost. So this includes deductibles, co-insurance, co-payments, and non-covered charges cannot be billed to the member. All right. So once you have hopefully submitted your claim and received payment, the next step would be to resubmit an authorization request when or if needed for that member. And that's something we will be discussing in greater detail in the coming months. So we will have more to share on how to do that when reauthorization is needed. All right, so I wanted to share a little bit about HPSM's modes of communication with our members, with our members and providers. We do have a website, hpsm.org, so we do encourage you to visit our site. There are a wealth of resources there for our providers. One of those is our provider manual. It is available all online and it is searchable. It contains all of the processes that our providers need to know, so it's a great place to reference. We also do send out faxes and emails to our providers, as well as quarterly newsletters and mailings. And then we hold webinars as well, including trainings and educational opportunities. Language access services. So HPSM members have a right to receive interpretation services for their language. And to help make that possible, HPSM provides 24/7 telephonic and video interpreter services at no cost to the member or the provider. And we have more than 200 languages available, including American Sign Language. They are available, interpreters are available on demand or by appointment. And you can visit this section of our website that is linked here for more information on how to access those services. We do encourage all of our providers to use them. All right, and so with that, wanted to share this slide that shares the contacts at HPSM if you do have questions going forward. We do encourage you to check out our website. Specifically, we have a page focused on CalAIM updates that's linked here. So that's a great place to check for any updates specific to you all and our CalAIM providers. If once you begin submitting claims, you have questions about how to submit that claim, why a claim denied, any of the claims information we shared today, you can contact our claims department at the information listed here. For questions about existing authorizations, you can reach our utilization management department. And for any questions about credentialing, your contract, or rates, you can reach our provider services department. Our main provider services email is listed here. And then for programmatic questions or any escalated issue resolution, you can contact our programs and partnerships team here. And again, we will share this presentation after today with everybody. And with that, I did want to open up our time for questions. If we could ask you to please enter your questions into the meeting chat tool, that will allow us to record those and share back the answers as needed to make sure that we're answering all of those. And so I'll just start reading these through here, and please feel free to type in your questions. Okay. Let me make sure. Okay, the first question I have here is, do you have a list of the ECM and CS providers contracted with HPSM? We do have that list. I'm not sure if it's yet shared on our CalAIM webpage, but I can follow up on that one and see if we can share that list.
That would be great. I checked it and didn't see it on the website.
Okay, yes, we can do that.
Yeah, and I wanted to add, this is Gail, that updates in regards to that provider list will be coming sometime in February.
Great, thank you, Gail. And then I see an additional question here. Who will primarily be referring into the community supports program? I may have to phone a friend on this one if anyone else from HPSM would like to chime in. If not, I can also take this one as a follow-up.
I'm happy to take it.
Go for it.
Yeah. So I would say there's a lot of different potential referral sources. To some extent, the program itself, because a lot of the community supports and services are so different from each other, it's a little contingent on what type of community supports you're offering. But I will say our integrated care management team, and Gail is the manager of one of those units, is a strong referral source, as are providers in the community. And that includes both PCPs, specialists, hospitals, as well as folks that are in the CalAIM relationship as well, the folks providing community supports or enhanced care management. So it's relatively open-ended, and it's essentially if somebody becomes aware of needing additional support and thinking that this is the pathway, that's available as well. Gail, is there anything that you would maybe add to that, or Dayani or others?
No, I think that's good. Thanks.
Yeah, I think that's great, Sophie.
Thank you, Sophie. Okay, the next question we have here is, what kind of claims are we submitting? Okay. Because I'm sure that others may also be able to chime in on that, but it would generally be claims for the services that you render for our members. All right, any other questions from others right now? If not, that's okay. I know we shared a lot of information, and I'm sure questions will come up over time as we all let this information marinate. I'll give it a few more minutes. Is there anything else that anyone from the HPSM team would like to add today?
Yeah, this is Gail. I just wanted to thank all of you for being here today, and just for your collaboration and partnership serving our highest needs members. So that is all.
Great, thank you, Gail. Yes, we're very excited to work with you all and continue our partnership. So thank you for joining today. Again, we will share this presentation and recording, and we look forward to continuing to work with you and share information going forward. So with that, I will be ending our meeting. Thank you, everyone. Hope you have a great evening.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.